Hi, welcome back to Auth the Cuff, Evacore Healthcare's podcast. I'm your host, Emily Coe. Today, we're going to talk to Dr. Erica David Park about utilization management and the role that it plays in the overall patient healthcare experience, especially when it comes to patient safety and patient empowerment. Hi, Erica. How are you?
Hi, I'm doing really well, Emily. Good to see you.
Hi. Nice to see you. Thank you for joining us today. Tell us a little bit about your background. And I know you're a physiatrist, and people probably misread that and think that you're a psychiatrist all the time.
Very true. That does happen. So yeah, I'll go a little bit into a little bit of my backstory. So, when I was in medical school, one of my classmates, my roommate actually, had a lower extremity amputation from a childhood sarcoma. She was the one who actually initially introduced me to the field. I didn't know anything about physiatry at all until I met her. So essentially what physiatry is, it's physical medicine and rehabilitation. So it's management starts off basically with disability, impairment, musculoskeletal disorders, neurologic disorders. It's really kind of like a whole person approach to the neuromuscular system. Mm-hmm. So the whole approach to it really just resonated with me, and that's what made me get into the field.
That's great. So just curiosity, is it one of those specialties where I know like dermatology is often sought after because they have really good hours. So is physiatry one of those specialties where you pretty much have set office hours?
Yeah. I mean, generally it's much more reasonable. So, I mean, it depends on if you do more the inpatient or the outpatient side. The inpatient side can be kind of busy. So it can get a little hectic there too. Yeah. But generally, most of the time for outpatient physical medicine rehab, it's not as stressful as some fields of medicine.
So when we hear the term utilization management, or when folks, the general population, they hear that term, we typically get some sighs, maybe some rolling of the eyes. And I think it's because people don't really understand what utilization management is all about and truly, what we're trying to achieve. It's not just a denial letter. So can you talk a little bit about what goes into utilization management and how, really it's about getting patients the right care at the right time?
Absolutely. So yeah, it's funny too. So when I finished residency and started in practice, I was thinking the same thing. I was like, oh goodness, utilization management, I'm going to get everything denied and it's going to be a big hassle. But then as you learn more about it, as time goes on, like everything in life, as more time goes on, you learn a bit more and you understand what it really means. So the whole idea of utilization management is making sure that patients are getting, the appropriate care that they need at the appropriate point in time, and that they're not, and that services also are not being overutilized, because there can be dangers with too much medicine, of too much of certain types of medical care can cause issues. So, generally with utilization management, it's not just a matter of denying, it's really just a matter of making sure it's appropriate, that if one thing is not appropriate, something else can be used in its place, and that there also is really monitoring and management of what's going on. Mm-hmm. A lot of what's done is really by looking at the medical literature. And so a lot of it's really science-based. We look at the science, we look at the actual data and see what should work for individual patients, rather than kind of just using anecdotal evidence.
Right. Yeah. So, and so my team, and as you know, my team works with you and other physicians to write the clinical guidelines that are used at EviCore to help determine what is medically necessary. Mm-hmm. And I know I'm very familiar with that process with reviewing the literature and keeping, creating guidelines and keeping them updated. What's that experience like for you at EviCore and working with the guidelines that help with utilization management?
Yeah, no, I've actually really enjoyed it. It's actually one of my favorite things to do at EviCore, honestly, because it's honestly, yeah, it's an enjoyable experience. I think a lot of it because you really get to look at the current medical literature and really see what's appropriate, what's not, and just stay really up to date with everything. Because I think back to to being in practice, you're busy. Like when you're in clinical practice, you're just so busy. Changes are occurring in medicine. Science is changing like so rapidly. It's hard to stay on top of everything. So, having people going and looking at the literature, taking the time to go through that and look at it and see what really is the true best practice, again, rather than kind of like anecdotal evidence, but what the science actually shows, I think is great. So for me, being like a science-based person,
Yeah.
I really enjoy it. Like it's actually, sometimes it's almost kind of like detective work sometimes too. So, you have something you want to look up, find out like, what is the information saying? Like, what is the current research saying? Has anything changed? It's kind of a cool process. I enjoy it.
That's great. And it's really cool to think about the evidence-based guidelines and its correlation, or not, maybe not a scientific correlation, well, and the association with patient safety.
Yes.
And how, what we're doing is designed to truly give patients the best care that they need, or that make the best decisions based on those guidelines. Now, with newer technologies, we know there are
Mhm.
things always coming out in the field of medical technology, and sometimes there's a lot of excitement around the technology or new
Mhm.
innovations, even if the data aren't there to support its efficacy and effectiveness. Maybe haven't even identified the indications for the technology. Can you explain how EviCore handles the new technologies,
Mhm.
and how we incorporate them into our guidelines, if at all?
Sure, sure. So with Evicore, I mean, we definitely make sure we stay on top of any new technologies. We find out that there's, a new procedure, a new device, anything brand new. We really stay on top of that. What we do is we'll actually take a look at the current medical literature and see, what does the literature show at that point in time? Is the evidence there to support it? And the thing is, and not just to support it, but to support that it's safe. Because it's exciting when new things come out. I mean, everyone gets excited, and there might be a news story about it or something. But the question is it safe? Is it going to work for the patients? And is it going to cause them harm, or is it going to be okay?
Yeah.
So really the key with what we do is to take a look at that literature, see what is out there involving, whatever that new thing is, and determine if it is appropriate at that point in time.
Mhm.
Now, if we look at the literature and it turns out it's not, and then it's still kind of what we call experimental and investigational unproven, at that point we wouldn't recommend it. However, we would still do periodic reviews because
Yeah.
literature changes very rapidly. I mean, a new study could come out like the next week that could, alter
Right.
our opinion. So we
Yes.
really make sure that we stay on top of it and really are regularly paying attention so that if we need to change our recommendation, we can always do that.
Yeah. Yeah, and a great example, not necessarily of new technology, but with the COVID, the
Yeah,
pandemic,
yeah,
that's another way that we adjusted our approach to help keep patients safe. We re-examined how we look at CT scans for
yeah.
patients who are COVID positive. So so even, as we have, global pandemic or epidemics and pandemics, we're still thinking about patient safety.
Absolutely. And that's really an example of like Evicore in action, right? As the pandemic's
Yeah.
happening, going and looking at the literature at that moment and seeing like what can we do? And not even just the literature, but it was, because it's an evolving process, but just
Hmm.
what information can we glean for this really unusual pandemic that's
Yeah.
occurring at this moment, and approaching it that way. I think it's an excellent way to do things. And it really makes sure that the patients are being taken care of the right way.
And then also there's the cascade effect of
Yes.
once you initiate examination, maybe you get some type of advanced imaging, and there
Yeah.
are incidental findings, or the patient just continues down the path of additional doctor's visits and imaging and tests.
Yeah. Yeah.
Have you experienced that as a physiatrist?
Yeah, quite a bit, unfortunately, because especially because a lot of what I did as a physiatrist in clinical practice involves the musculoskeletal system and disability and so on. So I've found it a lot with low back pain in particular. So a lot of times by the time a patient would get to me after they've already gone through the gamut and they've already had that diagnosis and they've gone through a lot of other treatments, and then they would get to me with this history of low back pain. I always found it interesting because low back pain in particular is a really common problem. I think it's one of the more common reasons that people just go to the doctor, period.
Mhm.
It's a really, it can cause a lot of a lot of injury, a lot of like missed days from work, things along those lines. So it's a big issue. But we find with back pain, it's not uncommon to find just incidental findings on imaging that might not directly be related to someone's symptoms. So as an example, I remember seeing situations where a patient patient has a history where they came in, they had an episode of back pain, and then unfortunately they had an MRI that ordered right away. So the MRI was immediately ordered. It showed something wrong, so there's like an abnormality on the MRI, but something pretty minor. Really, when you really look at it, it's maybe just like a little bit of degeneration that is really just likely age related and not really like a new major issue that needs to be addressed. It's just something that happened to be found on this imaging. But unfortunately, what would end up happening is that they would have that abnormality, and it's kind of like it sticks. So they're like, oh, I have an abnormal spine. And next thing you know, that's when that cascade effect happens. So, they end up on a whole bunch of different medications, some, muscle relaxants, sometimes opioids. It could be a whole bunch of different stuff. Then they might get more imaging done. They might get more procedures. A lot of times they'll end up getting like a lot of interventional procedures. And then sometimes it could go all the way down to surgery. And just from that like little sort of incidental finding, it was really unfortunate, what would happen. And to get back to that, to the whole idea of that, and with utilization management, that's in my mind, that's like a really key reason why utilization management is important. Because in that beginning, when that patient came in with that back pain, it could have potentially just been resolved with maybe a little bit of physical therapy, or maybe a little bit of anti-inflammatories and some ice. It could have maybe been nipped in the bud. Mm-hmm. But because of the fact that they went for that MRI, that's what caused the problem there in terms of the cascade. So, if there had been utilization management in that case, then probably that initial MRI wouldn't have taken place, and then it wouldn't have kept going on from there.
Yeah. Isn't it true that most low back pain resolves in about 4 to 6 weeks?
The majority of it does.
Conservative therapy,
Yeah, the vast majority of it does. And that's why you need to not just go straight to the imaging. You need to really, pause and do the right treatment. Granted, there are exceptions. If someone has red flags, like, there are, fever, there are other signs going on that may suggest that there's something more insidious. Yes, go ahead and get that MRI. That's kind of crucial. Yeah. But the vast majority of the cases, that's not it. So it doesn't really need to be done at that point in time.
Yeah. And I know, as physicians, when a patient comes to you, you want to help them. If someone says they're in pain, you're compelled to want to make them feel better. And then the issue of presenteeism, they're going to work because they're in pain, but they still have to go to work. And if not treated, then it will, of course, result in absenteeism because they feel like they can't go to work.
Yes, absolutely.
So as far as presenteeism and physiatry, how do you work with patients when they are in pain, but they still have to go to work? But it that 1 to 4 week time frame where the pain is not resolved, but they still have to stay functional. How do you work with that?
Yeah, it is a challenge, definitely, because right, there are people who just have to go to work for various reasons. They may not be able to take time off from work. So in those situations, really the best thing to do is really work with the employer too, just to make sure that everyone's on the same team, essentially. So the real goal in these situations is to get this person back to a full level of function, so that they're feeling good, they're productive, everything's working okay. And I think working directly with the employers in these cases is really the way to go. If possible, for some situations, the person might need just a few days out, like a couple days off, just to to get a little bit of rest and go on from there. And maybe they'll be better after that, and then they can be fully productive. Or it might be a different situation. So really, it's just a matter of paying attention to what's going on with that individual, and working with that person and their employer to make sure that the right treatment plan is in place. Because really, everyone just wants to get back to the same place where they're functioning as well as possible.
Yeah. So EviCore has taken utilization management into the world of post-acute care. And you work in the post-acute care space at EviCore. Can you talk a little bit about how that plays a role in patient safety and patient empowerment?
Absolutely. So in telling that, I can actually give an example of something actually we've seen a few times. So this isn't just a one-off experience. But with post-acute care, so essentially what it is, post-acute care is the care that someone's receiving after their acute care hospitalization. So that could either be going home with like home services. It can be going into a facility, like a skilled nursing facility for what we call subacute rehabilitation, an inpatient rehabilitation facility, or if someone has more advanced concerns, it's something called a long-term acute care hospitalization. So they can be going to any of those levels of care after they're in the hospital. So when we do utilization management, we take a look at where they should go, just to make sure that they're going to the right, essentially the right place at the right point in time. So whichever level of service is appropriate for them, that's where we're kind of tracking them to. So in doing utilization management, many times actually, we've caught cases where someone probably shouldn't leave the hospital yet. So, when we're actually taking a look and we're looking at the case, we see that, oh, wow, this person is having, their temperature has been spiking, their blood pressure is dropping. And sometimes they're just like subtle things that, not to say that the physicians in the hospital aren't, on top of it, but when we're looking at the whole picture, we sometimes can see these trends a bit more easily than someone who's just right there at that moment. And so there have been instances where we've caught situations where this person's clearly not ready to go anywhere yet. It's not going to be safe for them to leave the hospital. And in those cases, we've been right, So, we've been able to prevent potentially an adverse outcome, because if someone, especially if it's going to be like going home to home care, if someone goes home and, they have an infection brewing, that could be really bad. That could really be a bad situation. So, really having utilization management has been able to really protect people in some of these situations.
That's a great anecdote, because a lot of folks think of utilization management as just cost savings, and they don't realize the patient safety piece of it. So that's really great to illustrate how we are making the best decision for the patients.
Sure.
So there is a notion that the more expensive the test, the better it is. So do you see that often in utilization management, where maybe providers are asking for a PET scan, which really it's not indicated for whatever they are requesting it for?
Yeah. And I think it comes back to what you'd alluded to before, that, often in practice, physicians just want to help their patients. They want to do the best for them. But sometimes what you think is the best isn't necessarily what's the best,
Yeah.
And I think that's why it's really key to actually have the utilization management, where we can look at the actual literature and look and see, what is the literature showing? What is the actual best situation here? Not just based on price, but what is the actual test or procedure or whatever we're talking about that is actually going to be best for this particular individual. And, in practice, sometimes, again, because, science is moving so quickly, medicine is changing so rapidly, it's hard for someone to keep up on top of all that. It could be a situation where someone's been doing something for 20, 30 years, a physician's been practicing a certain way and doing an excellent job. So not to knock that person, but new information could come out that indicates, hey, this new way is a little bit better of doing it. Without the actual utilization management and without having people looking at what's current, it's hard to keep up with that. So I think, really doing with EviCore, we really are helping physicians out, because we're able to actually take a look and see, what the appropriate test or procedure could be. And again, as we're saying, it's not always the most expensive one. Sometimes it's the less expensive one that turns out to be the better one.
Utilization management is often 2 or 3 6 degrees of Kevin Bacon, right? Utilization management is often 3 degrees away from the actual patient. How do you feel that utilization management empowers patients?
Yeah, that's a good question. So I think it can give patients tools that, like, knowledge. So as we're talking about before, you mentioned that some people will watch like Dr. Oz or something, or they'll watch like a show, something in the media, and get information from there. But I think having utilization management, where we're actually looking at the actual data and getting the actual guidelines, that information, that's information that we can use to empower the patient to get the right thing for them.
Yeah, yeah, and also now that you talk about it in the letters that we send to patients, if something is
Yeah,
denied, they are given the opportunity to look up the guidelines that were used to make the decision. So we're not being secretive about anything.
right.
It's out there for folks to look up and to read about.
Absolutely.
Yeah.
Yeah, I think definitely. I mean, there's full transparency about it, so they can understand why whatever it is may not be authorized. And the other thing is to we make sure that in the denial rationales and in the letters that are sent to the patients, they are at a reading level that any patient should be able to understand. So we really made efforts were made for with that particularly to make sure that things are readable. Because I know there could be a lot of like medical jargon that I might understand, but not necessarily
Right.
everyone's going to get it. So
Yeah.
we make sure that the way the wording is crafted makes it very explainable and understandable, so they can really take a look at that.
Yeah, and I think it's a really great thing. EviCore does make the clinical guidelines publicly available. So
Yes. Yeah.
anyone can go to evicore.com and look up the clinical guidelines, which I think is really great for transparency. Um,
Mhm.
and related to the reading ability or reading level of the denial
Mhm.
rationales, we definitely take health literacy into concern
Yes.
in writing these. And it's not just writing it in like maybe a seventh grade reading level,
Mhm.
but making sure there are clear actions for what the next steps are.
Yeah.
So that's great. That really does. You've helped me, um, you know, reconcile that 3 degrees of separation from the patient on
Sure.
empowering individuals. So, how do you explain to patients why prior authorization is necessary? Because they go to the
Mhm.
doctor says, hey, I think you need an MRI or you need a stress echo, but first we need to submit it for prior authorization.
Mhm.
How would you explain to a patient that that's really the best thing for them, that we're not just trying to withhold care?
Absolutely. No, that's a good question because I'm sure it can seem like that to a patient who doesn't understand the process. But I think best way to probably explain this to them is to explain that it's for their safety, that we're really, and it's to make sure that there's not overutilization. Now, not just overutilization across the board, but sometimes for them too. What's interesting is because sometimes not all practices are integrated and connected to others, I guess, to other practices, someone could have gotten an imaging study with one doctor and the other doctor doesn't realize that that person already had it done, and maybe there's like another doctor down the line, and if everyone's not communicating, which unfortunately sometimes is the case, someone could end up getting multiple studies of the same kind. This can actually in some situations can be dangerous because there are certain types of imaging that have radiation. So there could be excess radiation exposure, medications too. That's another area where
Yeah.
there can definitely be a problem. I remember in practice a lot of times sometimes I would have like elderly patients who would literally come in with like a bag of medications, and different physicians that prescribe different medications. They often wouldn't even realize that sometimes they were the same thing because maybe there was one was a generic and one was not, so they didn't realize it was the same medicine or they were serving the same purpose. If there is appropriate prior auth, these things can all be teased out. So there's not like, overutilization of either medication, services, procedures, and things along those lines. So I think really the key is just to make sure that the patients know that it's in their best interest to have someone taking a look at this to make sure that, things aren't being overused for them, for their own safety.
Yeah, and it also plays into the what we talked about a few minutes
Mhm.
ago, how physicians are trying to do the best thing,
Yes.
but they don't always have the latest evidence. So submitting
Right.
that prior auth does help with that review. Um,
Right.
and also prior auths, there's a quick turnaround. Usually there's like a requirements to review prior
Mhm.
auth requests within, however many hours or days.
Mhm.
So it's not like they have to wait, a month to get approval.
Yes, yeah, absolutely, absolutely. Because really that's key. We want to make sure that if something is indicated, someone can get it in the right time, at the right point in time. We don't want people to have to wait for services or procedures and things along those lines. So yeah, there's a pretty rapid turnaround time from when the request is put in to when a decision is made.
Mm-hmm. Yeah, and I'm thinking of oncology patients as
Yeah,
well.
yeah,
So
yeah,
with oncology, there's a sense of a timing issue. Folks, maybe they're being worked up for suspected cancer or potential recurrence of a cancer, and we don't want them with that anxiety of
yeah.
having to wait longer than they should to get imaged, or to get the procedure that they need, when it's
Mhm.
related to cancer, because it's so emotional.
Absolutely. Yes.
Erica, thank you so much for being our guest today. You've been a great source of information about utilization management, and I think everyone learned a lot about how utilization management plays into patient safety and patient empowerment.
Thank you, Emily. It's been
Bye.
a pleasure.
Thanks for listening to Off the Cuff. Join us next month.